Jessica Bridgforth, Part 3, which is going to be me continuing going over the abdomen, cranial nerves, and also explaining a testicular exam for males. So Kelsey, I'm going to go ahead and have you lift your head up. Now look for any kind of hernia, which I see none. You can go ahead and relax your head down. And then I'm going to look for any kind of palpitations of the aortic. I feel that. And that's what I'm going to do the right and left femur, which is just above the suprapubic area. Do one. And I can do the other two. It's almost like down in the groin area. I feel both sides. You can go ahead and cover up your stomach. And then if you don't care to go ahead and sit up, I'm going to explain to you the breast self-exam again. And that's when you're going to have your arms to the side, your hips, and behind your head. And you're going to look at the dimpling on that. You're also going to see size. You're going to see make sure they're symmetrical and make sure there's no differences, any masses, anything like that you want to note. That's what the thing I talked to you about, how you put your hand behind your head and you would feel from in circular motion for masses inner and outer. And then also you do the opposite side. You want to do that monthly after your period, and any kind of abnormals report to your provider as soon as possible. If it was a male, I would also tell them to do it monthly. I tell them to do a testicular exam in the shower, and also they could do it in the mirror, both ways. And what I'm going to have them do is look at their penis, the scrotum. I want to look see if the hair distribution is equal, the urethra, if the placement of it, I want to make sure it's in the right spot. Any masses, tenderness, I would want to know that. I would look at the testes next, make sure that they also feel for masses, tenderness down there, any kind of lesions they need to report. And then also the vas deferens and the epididymis. I want to make sure those are all present and there's no masses or tenderness noted as they're feeling for those. And they would also, like I said, do it monthly and in the shower and in the mirror. If any abnormals, they would call a doctor on that. Okay, Kelsey, we're going to go over cranial nerves next. So the first thing I'm going to have you do is I'm going to have you close your eyes. I want you to tell me what you smell. So go ahead and let me know what you smell.
Alcohol.
Okay. Olfactory cranial nerve 1 is intact. Next, I want to turn and I'm going to sit and look at you. What we're going to do is I'm going to have you cover the same eyes I'm covering, and I want to have you go over and tell me when you can see my finger, okay? So go ahead and cover this eye first, okay? And let me know when you see my fingers.
Now.
Okay?
Now. Now. Now.
Okay. We're going to go ahead and cover the other eye.
Now. 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 Now.
Alright. And that lets me know that cranial nerve 2 is intact, which is optic. For 3, we're going to go ahead and use the Snellen chart. I'm going to have you stand up and come over here. And I want you to read this line down here for me. Cover one eye and go ahead and read.
E-G-F-Z-A-T.
Okay, cover the other eye and read.
E-G-Z-F-A-T.
And now keep both eyes uncovered and go ahead and read.
E-G-Z-T-F-A.
Okay, and what I want is for Kelsey's vision to be a 20/20, and that's what I would say it would be, with her covering both eyes. And then also, Kelsey, what we're going to do is go ahead and have you turn and look towards me again. And I'm going to have you look over here and stare at that outside, okay? And look over here. Okay, I see now the stigmatas on Kelsey's eye, and I just want to kind of watch for that as I have her look laterally, both sides. And then let me get my pen light. I want you to follow my pen light in these different spots I go in. So I'm going to do the 6 cardinal gazes. I'm going to go through those. I'm just kind of watching her eyes as I go through all these motions. Okay, and after that I would know her cranial nerve 3, 4, and 6 are intact, which is her ocular motor, her transducent, and abducens, and trochlear, sorry. So ocular motor, trochlear, and abducens. And next we're going to go ahead and have you open your mouth and close your mouth, and as you're doing that I'm going to feel. And what I'm feeling for is for trigeminal, which is cranial nerve 5. And Kelsey, clench your teeth. I'm going to kind of just feel and see if I can push it apart, and I can't. Also, close your eyes. As you close your eyes, I want you to tell me where you feel me poking the pen, okay? So go ahead.
Forehead. Chin. Left cheek. Right cheek.
Okay. So that also tells me that her trigeminal cranial nerve 5 is intact. Okay, go ahead and we're going to face the camera so they can kind of see. On this one, it's for facial, which is our cranial nerve 7. Go ahead and smile, Kelsey. Frown. About your cheeks. Okay, can you raise your eyebrows? Okay, all those facial expressions let me know that Kelsey's facial nerve is intact, which is cranial nerve 7. Now the next thing we're going to do is listen for cranial nerve 8. Or I said listen, but we're going to look for cranial nerve 8 to see if it's intact, and that's the auditory. So first thing I would do is a Weber test. I need a tuning fork for that, which I don't have one. We'll pretend though that I have one here. And what I would do, I would strike it, and I'm going to put it in the middle of Kelsey's midline between her 2 ears. And I'm going to have her tell me if she can hear both sides equally. Do you hear both sides equally with the Weber test?
Yes.
Okay. And I would make sure that she can hear those. If they're not equal, I would note that. And then we do a Ren test. I'm going to hit it, and I'm going to put it on the mastoid bone. Tell me when you quit.
No.
Okay, feeling that vibration. And then I'm going to let you listen.
No.
Okay. And then I do the opposite on the opposite side. So I come around, I re-strike it again, and then we're going to put it behind.
No.
Okay. And that would just pull it away.
No.
Okay, and I want the air to bone conduction to be 2 to 1. So she should, the air should be longer than the bone conduction. And that lets me know more about her auditory cranial nerve. Kelsey, can you cover your ear? I'm going to whisper something. I'm going to let you tell me. This would be easier if I could come around, but go ahead and cover this ear, please. There you go.
Basketball.
Okay, go ahead and cover this ear.
Baseball.
Okay, and as I whisper those, it also tells me Kelsey's cranial nerve 8 is intact. Okay, which is her auditory. Next we'll do 9 and 10. So for 9 and 10, Kelsey, what I'm going to have you do is, I'll sit down. For 9 and 10, I'm going to go ahead and have you say I. Alright, and can you swallow for me? And you can also check her gag reflex for 9 and 10, which is her glossopharyngeal, which is 9, and then 10 is going to be my vagus nerve. But I'm not going to go ahead and gag her today. We'll say that for you. And for swallowing, you can actually have them drink something on that one. But cranial nerve 9 and 10 are intact. While I'm at the mouth, I'm going to go ahead and do cranial nerve 12. Go and see your tongue out. Can you move your tongue back and forth? There you go. That tells me that cranial nerve 12, which is hypoglossal, is intact. And then also, I'm going to have you shrug your shoulders. Okay? And then I'm going to have you put your head towards my hand. So go ahead. You can do the other side. Kind of resistance there. Okay? And that lets me know that her spinal accessory nerve, cranial nerve 11, is intact. So that's all that we have to do, Kelsey. You have any questions for me?
Nope.
Okay. Thank you so much.